Hi there. I know it's been a little while. I just wanted to take a minute to check in and do a 1 year Surgiversary video. Even though I'm a little late, I'm like a month late, a little over a month. But anyway, so I'll get right into it. So last year, March 20th, 2017, I had the vertical sleeve gastrectomy done. I was 238 before surgery, 232 day of surgery, and the lowest number I've seen since then was 167. Since hitting 167, it has been a struggle. I would say since I was around 9 months post-op, I think that was around the time I hit 167. I've kind of went up and down, up and down. I don't know, it's been hard. Got back up to 175 at one point, went back down a little bit, and now I'm back up to 175 again. But as for my appointment, I was 172 at my 1 year post-op appointment. The doctor said I had lost right around 60% of my excess body weight in the first year after having surgery. He said that is exactly what they tell you the surgery alone will do for you. So the surgery did its job. He said I will notice, which I already knew this before he even said it. I can tell. To continue losing weight, it's going to require real effort. And he said even just to maintain now. Like, it's not just going to be super easy anymore. I can eat a little bit more than I could after surgery. I don't know. It's just different than it was right after surgery. Right after surgery, this was all new. I had this extra motivation. I think you slowly start to get a little more comfortable over time again. And on top of that, you can slowly eat a little bit more. So can I overindulge and eat like 4 or 5 slices of pizza if I wanted to? No. But could I eat a slice or two now? Yeah. And could I eat that every half hour after that food goes down? Absolutely. So it's a struggle. It's a struggle now. I could eat junk and garbage all day. I could eat king size candy bar and then 2 hours later or an hour later have couple slices of pizza, and then so you can see where weight gain can happen again. Like this surgery doesn't automatically make you stop craving things or make you not a food addict or whatever, which I realized I definitely am a little bit of a food addict because sweets was always my biggest problem for me personally. Like I have a big sweet tooth. Before surgery, it was always chocolate, either chocolate chip cookies or like warm, like good chocolate chip cookies, not Chips Ahoy or something. But it was always like chocolate chip cookies or like chocolate candy bars, stuff like that. So after surgery, I tried like, okay, if I want something sweet, I'm just gonna have a little bit of ice cream. Well, then I started loving it and becoming addicted to ice cream. So then I stopped with the ice cream. I'm like, I'm not gonna keep having ice cream. So now for a minute there, I was going to Taco Bell sometimes for lunch. If I didn't bring a lunch, I was either going to Subway or Taco Bell. I was trying to stay away from burgers and fries kind of places because I feel like that could be a big downfall for me because I liked those places a lot before surgery. So if I went to Taco Bell, I would just at first get like a cup of pintos and cheese or something for lunch, or I would get a cup of soup from Subway because I'm not a big sub person really. So then, before I know it, I started getting cinnamon buns. Well, then I'm craving cinnamon buns every single day and going to Taco Bell way more than I should. So I'm like, all right, no more cinnamon buns for me. I'm taking a break. Like, don't try them if you haven't because they're good and they're addicting. But anyway, so I stopped with those. And now my thing is like Slurpees and Kit Kats. Like, I want to go get a Slurpee and a Kit Kat with my Slurpee. Like, I don't know what's wrong with me. This is hard, you guys. It is hard. I feel like the struggle is real, just about almost as hard as it was before surgery again. Like, it's hard. This is going to be a never-ending battle for anyone who's had food addiction or serious issues with food. The surgery will help you. It's a great tool, but it's definitely not going to solve all your problems. Like, it takes a lot of effort from you, especially after the first like 6 to 9 months after you have the surgery. It's definitely hard. I'm constantly like starting to get out of control and then reeling myself back in. I just went to the store today and bought a bunch of stuff for salads, hoping I can eat a little better this weekend. But yeah, it's an ongoing struggle. Anyhow, as far as the rest of my 1 year post-op appointment went with the doctor, I've developed 2 side effects, I guess, from the surgery. I feel great, but I did develop gallstones, which is common for weight loss surgery patients. It's common for people who've lost a good amount of weight in a short amount of time. I had my first gallbladder attack the end of October. I was having severe pain, like right here in my upper stomach, almost into my chest. So I wasn't sure, is this my heart? And then it dawned on me, this could be my gallbladder. So I'm wondering, so then did I Google it or had my husband Google it? I don't remember. But we were on our way to the hospital. That was my first time ever going to the ER for myself. They ended up doing an ultrasound and finding that I did have gallstones. At that point, the ER doctor said, sometimes if you've only had one attack, it doesn't necessarily mean you'll have repeat problems. So at that point, he said he could refer me to a surgeon or I could go back to the surgeon who did my sleeve, but it's not necessarily something I needed to rush into at that point unless I was continuing to have problems. Well, the end of December, I had another attack, and they are super painful. They lasted about 20 minutes and then slowly subsided. But the one in December, that was painful. I didn't obviously go to the hospital for that one because I already knew what it was. Luckily, it subsided on its own. But so at this point, since then I was having some mild issues, sometimes getting nauseous, having some mild discomfort in that area. And I just feel like I know it's gallstone related. So anyways, when I saw my doctor at my 1 year post-op, I told him about it. He said with me having repeat issues, he definitely recommended me getting it taken out because it's probably a matter of time before I end up with an emergency attack where a stone gets lodged and doesn't come out. And then that can lead to infection or serious issues, or the attack might not subside, and then they have to do emergency surgery. So rather have it planned out than if something like that happened. Plus these symptoms I've been having, I just don't want to have to worry about it anymore. So I'm nervous to have another surgery. However, I will be relieved to not have to worry about this anymore. And I do feel a little better knowing, like, some people in my family had gallbladder surgery and they all were fine afterwards. And my mom said it was well worth it. Like, she had to have it done when she was younger, and she said it was the best thing she could have done because she was having repeat attacks before hers was an emergency attack when she had to have it taken out. So, I think it was an emergency attack when she had to have it taken out. But anyway, so there's that. My other issue is vitamin deficiency. So they had told me early on that I was low in vitamin A and vitamin D. I started taking A and D. When I went back for my 1 year, they told me when my blood work came back that I was still a little low in the A, but it had went up, so they weren't too concerned with that because looked like it was going back up. The vitamin D, however, went even lower. So I'm in the vitamin D insufficiency category. If I drop one more point, because my level's 21, apparently 20 or lower is vitamin D deficiency, which can be serious. So they want me doing 6,000 IUs of vitamin D a day. So I have a couple different vitamin D supplements, and that includes whatever's in my multivitamins. So I actually rotate between a few different multivitamins. And then I try to take D. You can't take it with your other vitamins. You're not supposed to. So I take D. I try to make that my priority. If I'm going to take any vitamin, it's going to be D. So I will take that first thing in the morning, and sometimes I'll try to take it again in the evening or at night. Well, I always try to take it again. So anyhow, that's that with the vitamins. So, I don't know. I guess that's it. I think that's everything right now. I will check in again soon. I will let you guys know how gallbladder surgery went. And whenever I go to my family doctor again and because now I have to go, I'm going to follow up with my family doctor. I will let you guys know how my vitamin levels, if they're going back up. I do live in Michigan, and the sun is out again, and spring is here, finally. So hopefully with the sun being out, like, that'll help big time, because I'm outside a lot in the summertime. So, we don't really get any sun or much sun at all in the winter. So hopefully that'll help too. But all right, you guys, thanks for watching. I will hopefully talk to you all again soon. Bye.